I guess since I was young, I don't want to see people suffer. This profession can really help people, at least reduce suffering.
To be a doctor is my a childhood dream. When I had my first child, the pediatrician we had, Dr. Mala Stern in Mount Sinai, she is the one really inspired me to be a pediatrician.
By delving deep into the lives of their patients, learning about their stresses and struggles, our healthcare heroes tailor their care to each unique individual.
Patient care requires a lot. It requires active communication with patients, active listening, be culturally sensitive to what they want and what they need.
Your only goal is to provide the best care to your patients. Do the most you can to make sure your patients are healthier and happier.
We don't just treat the medical problems, because a lot of physical illness are caused by psychological issues. So we spend enough time with the patients, we find out the problem with the patients, where is it work, where is stress coming from, and then we can solve their problems better.
Compassion and empathy is very important, and that we provide it with a certain level of sensitivity and care and empathy for patients.
上个月我女儿满月的时候报来体检，然后诊所挤满了人，医生让我们先体检完就先回家，说新生儿抵抗力差。医生的做法让我非常感动。
It is very crucial, vital. There's a good trust relationship between the provider and the patient.
She's responsible, caring, and very detail-oriented. We had a big family, and she's always there for us, for every single one of us.
但是呢，她就是总是鼓励，让你自己锻炼，去到外边打开眼界，去晒太阳，叫自己阳光一些吧。所以我觉得特好。
I always have a lot of conversation with the patients. I know them very well. After they tell me the problem, I give a very detailed explanation how to solve the problem. They trust us.
我就觉得医生，特别是宋医生啊，我就感觉像个亲人一样。
In the hearts of those who heal, each day unfolds as a tale of empathy and fulfillment. From mending lives to nurturing bonds, their journey is a testament to the profound impact of compassionate care.
Trying to conceive is such an important part in people's lives, and then when they have trouble conceiving and you can help them and you're successful, that's really kind of a life-changing experience for not only patients but for us too.
Yesterday I saw a kid. So for this little girl, she lost both parents when she was only 2 or so. But this aunt was brave enough to take the responsibility at her over 50 years of age to start to take care of this 2 years old. And when the first time they came to my office, the kid has very little verbal skills. So I was encouraging the aunt a lot. I can see she's also struggling. And then after a year or so, I saw her yesterday. She just came for some rash on her hands. It's such a lovely kid, and she can speak English, she understands Chinese, and she has a very close bonding to her aunt. I already see the change. She found her home. Imagine if this aunt did not take this over, started at 2, what kind of care she can get. And for me to see her growing, I'm looking forward to see when she's 18, 28.
In the intricate healthcare system, doctors navigate their own hardships, striving to provide the best care possible.
Even though we are solo practice and we have the advantage of making decisions on your own, we still need a good backbone to support a lot of administrative kind of work.
CAIPA assists the clinic to meet the needs of the community by taking the administrative burden off of the provider and the provider's office.
The providers rely on us to help bridge the gap for programs that they're enrolled in, and so they can focus on providing the best care for their patients.
CAIPA helps us almost everything since we started our clinic. Whenever we have questions, there's always someone to be there to answer our questions.
Preventive care, which is the most important thing. For this, we invent something called point of care. The point of care is a computer software. Tells the doctors your patient didn't do this, didn't do that, and you have to call the patient and to get them come in and to get the services done. From that, actually CAIPA become the #1 efficiency and quality in New York State 4 years in a row.
There's so many obstacles to practicing, especially in private care, dealing with insurance companies, dealing with hospital systems. CAIPA is the bedrock of being able for us to maintain our private practice.
CAIPA is a very unique organization. It is a mission-driven type of organization. It's a win for the payers, it's a win for doctors, and a win for patients. At the end of the day, we want our patients in our community to receive the best care.
So healthcare is super fast-paced. New technology comes out, new regulations, new trend, new mandates. Our main goal is really to help our providers stay independent. It's an honor to be able to serve our life-saving CAIPA providers and help them navigate through the complicated healthcare system.
CAIPA empowers Asian physicians to foster healthier communities, nurturing well-being through thoughtful wellness initiatives.
Self-care is important, is integral to maintaining a work-life balance. If you don't care for yourself, how are you going to care for anyone else?
CAIPA Wellness Program is really a big bonus to all of us. But the key thing is it serves the purpose to allow us physicians so overworked, burnout, to be together, have 1 hour of the day to call it my time.
And the CAIPA is so wonderful, providing the opportunities for their providers to have physical exercise. And when we all do it together in CAIPA office, and so many colleagues, we are sweating and having fun and improve our health. It's really a good experience, and I'm hoping more and more do the same, join us.
How many times my patient told me, you look younger and you lost weight. I said, yeah, because I exercise. I feel like I set a good example for my patients. That's the best thing.
The wellness program is a very vivid example of what family is about.
I'm very thankful for all the help I'm getting from CAIPA, and thanks for everybody's help and the support.
Thank you for trusting what CAIPA team has to offer, and thank you for providing all these excellent care to our members.
All my colleagues are so dedicated to our community, so culturally in tune. I'm so proud of just being part of this CAIPA community.
I would always want to say thank you to the doctors. They are the most hardworking physicians that I've ever encountered. They really care about their patients.
And I'm hoping CAIPA will become bigger and stronger so we can have the best care for this population in this area.
We want to thank you for your unwavering commitment to the health and well-being of your patients, and our healthcare community is like a chain, and every link is important.